This conference will now be recorded.
Well, good morning, everyone. Welcome to our 16th COVID-19 conference call. For those of you that don't know who I am, I'm Wayne Mitchell, and I have the privilege of being President and CEO of the Nacogdoches County Chamber of Commerce. I see a lot of familiar faces here, including my chair-elect, Ted Smith. Good morning. And several of my board members and members of the media. I want you to know that we're recording this call and that members of the media have been invited to participate on the call as well. I'd respectfully ask that you all put your phones and computers on mute until we're ready for questions. Again, I remind you that the Chamber has a wealth of information on the Chamber website. You can reach it at www.nacogdoches.org. Please visit the section that's titled COVID-19 resource page, and you'll have great information. We updated it as recently as this morning. I'm really pleased to welcome a friend of ours, and somebody who's familiar with the Nacogdoches County Chamber of Commerce, Mr. Kevin Warren. Kevin is president and CEO of the Texas Healthcare Association, and among the many constituents that he represents, long-term care facilities. And as many of you folks know, the long-term care community has been impacted in a great way by COVID-19, and I know that all of us are anxious to hear what Kevin has to say about how his organization is helping his constituents and members address this very serious challenge that we're all facing as well. I'm also pleased to remind everybody that the Texas Healthcare Association has been a friend of this chamber for a long time, as a major sponsor of the Lone Star Legislative Summit. And even though we weren't able to execute it this year, we really appreciate their support, both current and past. It's really a privilege to welcome Kevin and to hear the message from his organization. Kevin, good morning and welcome to Nacogdoches.
Wayne, thank you, sir. And I will also, again, echo and say thank you to the Nacogdoches Chamber of Commerce and its members. And Wayne, as you mentioned, we have very much appreciated being involved with the Lone Star Legislative Summit. And you know, from the word go with our involvement with it, to see the community come together the way that it does, I mean, it's inspiring. And so it's always been easy for us to go back to the board and say, hey, you know, we've got to make sure that we continue to be involved. So thank you for that. And I appreciate again the opportunity to speak with you all and the folks on the call today about, you know, about long-term care. I will tell you, I have been in long-term care in some form or fashion. I started off as an administrator many years ago. So I've been involved in long-term care for north of 20 years. And I can candidly tell you, I've never experienced what we're going through right now to the degree. Having gone through, you know, you talk about natural disasters and things like that, but even with, as we reflected early on with Harvey impacted not the entire state, not the entire country. And so the shifting and the adjustments that have had to be made with COVID as compared to previous disasters has definitely been a challenge. But at the same time, the hope long term is that it really puts a different light on the long-term care profession and allows us to look at ways that we need to reflect and move forward. When you look at today, so it's roughly been about 19 weeks since restrictions were imposed on long-term care facilities, both assisted living and skilled nursing, back in the middle of March. And so what I want to talk about in the time that I've got with you all, and then obviously open up for questions, is just the perspectives from inside the facility, what the current status that we know is, and then ways that you all and folks within the community can get involved, and if they have questions, answers that they're not getting. So let's first talk about with the March restrictions that have been put in place, and that from the middle of March forward, put in place by the federal government, by the Centers for Medicare and Medicaid Services, and then further implemented through the governor's office. In essence, as you all know, there have been restrictions to non-essential personnel going into facilities. At the same time, the communal, what we call communal activities or you know, actions in the facilities have been limited. So anybody, you all that are familiar with long-term care, you know, it's large group gatherings, whether it be activities, whether it be dining, those have all had to be limited. So the communal aspect of long-term care has changed significantly. At the same time, screening has been put in place from the very beginning, where everybody that comes into the facility is screened for, temperature checks, for asking if they've been around somebody that's recently tested positive. If there are those communities where you have staff working in multiple locations, have they worked in a facility that someone has tested positive? All of these with the intent to protect and prevent COVID from getting into the facility. At the same time, this has really also been an extension of infection control requirements that are and have been in place for a long and extended period of time, and requirements both state and federal level. But what this has done on the infection control side is really expanded it and put more pressure and emphasis on, when we look at what we know and what we're seeing about COVID, and particularly the asymptomatic spread, which is of significant concern, not only in the communities, but within long-term care facilities. It's almost imperative that everything is done right every time. And that's when we talk about infection control, it's about ensuring that, that commonly used surfaces are wiped down, that the masks are always worn, over the face and the nose, and that they're wearing, staff is wearing the personal protective equipment the entire time, that they're taking it off as guidance directs, between, taking care of patients. All of this goes into this, and what you're seeing in the part of the many challenges that providers are dealing with is that as a result of the impact of COVID, particularly with the requirements of quarantine and isolation of staff, and then with the spread of staff, because again, you've got, with the communal aspect of this being separated out, you end up seeing and experiencing a lot of one-on-one care has to be provided. And at the same time, because of staff that have to be quarantined or isolated from home for 10 to 14 days, we're seeing it's putting a significant strain on staffing, because you've got staff that are working 8, 10, 12, 14-hour days, ensuring that they're covering and doing everything that needs to be done for those residents. At the same time, as the guidance continues to change, we were talking about this, I was talking about it with a colleague last week, that really since March, the guidance has changed. The CDC guidance for long-term care has changed about 10 times as they continue to learn, and as we continue to learn more about the virus. And so now what we're seeing is you in essence have within the facilities who have tested positive, have a resident that is tested positive, you will have an entire unit that is for COVID positive residents. You will have an entire unit or wing that is residents that do not have COVID. And then you will have a third area, if you will, that is unknown. And this is someone that it was maybe admitted from the hospital or admitted from home, that again, because of the guidance, you're uncertain, so you keep them in their own separate unit, which also requires that you separate staff. And so it's a lot of these efforts on infection control and other steps that folks are trying to take in working through this. One of the other challenges, but I would argue one of the more important things that facilities are also working through, and key to this, and I'll use this to jump into, I know one of the questions that we get often right now is communication with families. Since March, facilities have been required that when a resident or staff member does test positive for COVID, that facilities are required to notify the staff, all staff, residents, the families, and also required to notify their local Health and Human Services Commission and then local health department, and communicating with them. Now those communications have been expanded where they have to post online. You also now have the additional communication through the CDC and the public reporting of the data. But all that to say, one of the challenges that facilities are consistently and trying to work to overcome is how to effectively communicate with the families on what's going on. Because while, and these are conversations I have pretty frequently, I've had them not only with facilities, but with families, is recognizing that while it's easy to send out a mass email to give updates, the bottom line is that the families want to know, really, how's mom doing? How's dad doing? How is he feeling? Is there anybody else that he's been around that's tested positive? that requires the one-on-one phone calls. That requires the additional level of effort that facilities, whether it be through, again, through social media or through literally just one-on-one calls or FaceTime, are trying to figure out how to communicate effectively with families, and at the same time, allow families to communicate effectively with their loved ones. And that leads me to, and then I'll come back to some of the challenges that we're still working through, but that leads me to where are we at right now. And as I mentioned early on, that we're now in week 19. Our focus really right now has been on, while we're doing everything we can and we're working with elected officials here in the state as well as at the federal level on issues like staffing, making sure there's enough PPE, making sure we've got adequate testing and everything that's involved about from an infection control perspective. Our focus literally over the past couple of months has been on the issue of visitation. And unfortunately, what we're seeing is the unintended consequence of, in the effort to protect the residents from spread of COVID coming into buildings, we've got to, and this is what we're working on and working with elected officials, we've got to figure out a way to reconnect those families with their residents and with those loved ones in person. I will share with you that back in May, we were working with the commission and the state agencies and others on developing a reopening plan that would start with starting and looking at your facilities that were COVID free, and then phasing in, similar to the recommendations that came from CMS, being able to phase into further reopening steps. Unfortunately, however, over the last few weeks, when we've seen the spike in the community spread that's occurred across the state, that has, if you will, pushed pause on the visitation process. There is still discussion about looking for ways to allow for reopening, or not reopening, but for visitation in facilities that are COVID free, and more specifically allowing external or outside visitation. But right now, that's one of the issues that we're working through. Is we've got to figure out a way to ensure not only the health and safety of the residents and the staff in the buildings, but at the same time, we've got to find a way to connect those families with the residents and allow them to see each other in person. It's more than just FaceTime. It's more than just than just a phone call. And so, if I would tell you that I'm probably on calls with the state or with state agencies or others daily on the visitation as they're trying to work through, and we're trying to figure out efforts to overcome and to figure out ways that we can reconnect those families. And so again, that's one of the things I'm interested in getting feedback from you all on is ideas or thoughts or questions on that. As it relates to current status in terms of within Nacogdoches and kind of on a broader scale, one of the things that we watch and monitor is within the public health region 4-5, which is, according to state health services, that's where Nacogdoches County is. According to their data, there's 91 facilities that at some point have had at least one individual test positive for COVID. Within that public health region, there's about 150 facilities. Looking at, according to the data from yesterday, it looks like there was about 982 I shouldn't say either, 982 residents that, according to the state health services data, have tested positive for COVID in public health region 4-5 and nursing facilities. That doesn't mean that there's still 982 residents that are positive tested. It just means that those are cumulative numbers. The same goes as we're seeing on a statewide basis, that yesterday's report was showing that there are about 878 total facilities affecting about 11,000 residents that have tested positive, compared to, I want to say it's I think we're almost up to 300,000 that have tested positive in the state of Texas. So these are one of the reasons that this is important, and one of the reasons that I bring that up with respect to the visitation and how do we address that is is really working to make sure and working with our facilities to remind them of the importance that if they're talking to their staff, because the staff are part of the community. And the research indicates that when you see spikes in communities, it increases the likelihood that the virus can get into the building. And so it's really about making sure that the residents, that the staff and everybody is continuing to be vigilant, that communities are being vigilant to do everything they can to prevent the spread so that we can get back to the visitation. We can start to phase back in and to reconnect families and reconnect loved ones. Because again, as I said, it's been 19 months. Last point I'll make, Wayne, and then I'll stop talking, is question we get often: how can we stay updated? What if we do? If we don't know, we don't feel like we're hearing information, and we've got a loved one in the facility. If you don't feel like you're getting if you don't feel like you're being communicated with, I would encourage and re-encourage you, call the facility, and ask to know, what's going on, ask for updates, and communicate with them. The facilities recognize and understand the importance of that relationship, and so make sure that you're communicating with them. Also, coordinate with the facility on electronic visits and electronic communication, and reach out to them for ways that you can find, again, whether it's FaceTime, whether it's Zoom, all of the other various social media communication outlets, in order to attempt to reconnect or to connect with loved ones. I would offer this too: if you're having difficulty getting through, or you may not be comfortable with talking to the facility itself, don't hesitate to reach out to the association. Don't hesitate to reach out to Texas Healthcare Association. Ask for me. Ask for any member of our staff, and say, hey, this is what I'm trying to find out. Can you help me? That's part of our role, and that's part of the responsibility that we want to provide within the communities. And then lastly, I would, if you don't have a loved one in a facility, but you say, but gee, I want to get involved because I recognize the concern over the isolation and the lack of visitation, we implemented a program called the Adopt a Nursing Home Initiative about 3 months ago. You can find it on our website. And what we do is we will connect you with facilities within your area where you can, we've had families that have, that their children have created cards, or they've sent letters, and really just to try to engage both not only the residents but also the staff, so that they understand that the community is looking out for them. The community is invested in the success of the staff and taking care of these residents, and ensuring that the residents know that they are loved, that people are concerned about them. And so with that and you all's efforts to stay vigilant, and we figure out ways to work through this collectively. Wayne, I'll stop there, and so that if there are questions.
That's great, Kevin. Thank you very much. Questions from our participants?
Hello, Wayne. Can you hear me?
Yes, sir.
Yeah, this is Travis Clardy. Kevin, good to see you this morning. Thank you for joining us. And one thing I want to tell everybody is I cannot tell you how much I appreciate the Texas Healthcare Association, the work they've done, and how supportive they've been. I've been involved with that profession and those people in my legal capacity through the years, and they've really found it to be an exceptional group of people. And they're, long-term care. The emphasis is on care. It really is a tremendous group of people, his board that he works with, and they do care deeply about the people that they serve, and do it's a tough job under the best of circumstances, but now it is even more difficult. And Kevin, what I'd like to ask you is, we all saw what unfolded in Seattle with the Kirkland facility, which was an absolute disaster. Then we saw what happened in New York, and how there was a push to admit infected people into previously uninfected facilities, and the numbers of deaths and illness that resulted in. I think in Texas you took some lessons away from those and really were out ahead of other health agencies and organizations, and particularly in the area where it came to testing. And I know of specific of your members and places that didn't wait for the state to provide you free equipment or test or run through the state, but really took it upon yourselves at your own expense, of the owners and operators of these facilities, to engage in very, very active early testing. And could you talk about that and how what results came through those efforts?
No, it's a great question, and I appreciate you saying that, Representative. And you are correct that there were lessons learned and takeaways from both Kirkland. We are extremely appreciative of the fact that there was lesson learned from New York, that mandating that facilities take COVID positive residents from the hospital is not a good idea. And that's not what this is about. So we appreciate that no one in leadership here has made that suggestion. But as it relates to testing, one of the things that one of our board members says all the time is, you can't fight what you can't see. And so that's why, and so because of the asymptomatic nature of the virus, that's why the testing has been so important. And from the beginning, next to the request for the requirement of personal protective equipment, we have been recommending and requesting that we have to do some level of ongoing testing, because the challenge that you have testing, and any of you, even in the communities, have tested, but you've heard this, is that the test is only as good as the date that you got the test. And so it's very point in time. But from a nursing facility perspective, it was extremely valuable for the governor to have the mandated testing of all skilled nursing residents and staff, because it allowed facilities to establish, if you will, a baseline of where the focus is, and is it in our building, particularly because you have individuals, both staff and residents, that could have it, but they don't show symptoms. To Representative, to your point, however, because it's very much, if you will, point in time information, we have multiple members and providers that have committed to that ongoing effort of the regular testing. And I know of some that will do weekly testing, others that will do every other week. We have some that will do it, kind of on a rotating monthly basis. In recognizing that even though the cost of this is roughly, from talking to the facilities, an average facility, it's anywhere between 10 to 15,000 a week of added cost they're paying to do this. They recognize that for both the health and safety of the residents, but also of the staff, that we've got to have testing as part of this regular process, so that we can fight it. And once we know it's there, we can do everything we can to mitigate it and get it back out of the building.
Thank you, Kevin. Any other questions for Mr. Warren?
Hey, Wayne, one thing, because Judy will get on to me if I don't. Judy has, we had recently, her father passed away, but had been in a assisted living place for a period of time. And through this ordeal where he was not able to see visitors. And one thing that I would suggest, and as you develop policies, I know it's a very difficult thing to do, but if there was a way for families to designate even just one person of the family, so not an open visitation, but if families can designate one person, and it could be a caregiver, it doesn't have to be a family member, but just so there's just one who can be screened, go through the testing, present with a negative test, do the temperature check upon entry, do the outside visitation where appropriate. But just I can tell you that it made a tremendous difference for her dad to a rehabilitation center where he was able to have one guest. And I can tell other examples of constituents where just that single contact with a family member really made a dramatic impact on recovery and of mental health and of attitude. And so, again, I appreciate the challenges, but maybe if we can limit down the number of people who are approved, but at least so there's someone, whether family or caregiver, that would, I think, go a long way to alleviate. If Jerry Jones is at the doctor this morning, I'll tell you, probably easily top 3 questions we have gotten throughout this is, when are we going to be able to go see grandmother, granddad, mom, dad? Is a top issue, whether it be payroll protection or anything else you can think of through COVID. Top of constituent concerns has been, how do we get to see our loved ones? So, and I know you guys want the same thing. So appreciate what you've done, and let me know how I can help, Kevin, anyway.
I appreciate that, sir. And yes, and just I can't again say enough, visitation to some degree, whether it's external, whatever, is top of mind and is a priority for us right now, because there's a recognition that in some form or fashion, COVID will be here for a long period of time, and we can't continue to not allow families to have that connection that is so sorely needed. So we will continue to push that. As ideas come up, please let me know.
Kevin, one last question on my end. You know, I track pretty much on a daily basis the folks that are impacted here in Nacogdoches or Nacogdoches County through the good work that Anna does and here at the city and distributing, and Amy distributing information. And initially it looked like there were a lot of folks reported out of the LTC, the long-term care facility, when I say initially months ago, and now it seems to be less and less numbers from the long-term care facilities. And is that a promising sign that, or is that my imagination that we're seeing less?
No, I mean, I think it is a promising sign when you see that occur in the communities, because again, as I mentioned earlier about the frequency in which the ongoing updates, either from the CDC or even with Health and Human Services Commission, there's a guidance report that they put out that I want to say has changed now, has been updated at least 11 times. And so as you know, as facilities continue to learn, and as we learn more about the about COVID and its asymptomatic spread, as the vigilance increases, I think that's what you are seeing, is that you're seeing facilities that, you know, you're not seeing the numbers go up as much. And then when we do find it, or when a facility does test positive, with all of the steps that are going involved, with the involvement of the local health departments and everybody else involved, it's getting it under control quickly to get it out of the building, because the level of stress that COVID puts on a facility once it gets in there is enormous. And so everybody wants to make sure that if it has to get in, it's controlled very tightly, but at the same time, do everything you can to keep it out.
Well, thank you, Kevin. And look, we want to take, first of all, you're welcome to stay on the call. We're going to have several other folks make some
Is there any way I
comments.
can ask a brief question? This is Donna.
Go ahead, Donna.
Okay, this is Donna from Channel 9 News. Under the current circumstances, I would guess that there are families who need to have their loved one placed in a long-term care facility, but are reluctant to place them in one. Where are these people going, and what is your recommendation to them?
Boy, Donna, that's a great question. And we do know that there are some that are making that are, because they don't know where else to place their loved one, that they are placing them in a facility. And what we understand right now is that with those where they're uncomfortable, whether it be because of the lack of visitation that will occur, they're staying at home longer. And I know that again, that's one of the other important factors of trying to address, and I shouldn't say trying, addressing the visitation policy, because we know that is one of the concerns that if you will, consumers and families have expressed, that if I admit my loved one to a facility, then I'm limited from being able to see them until the visitation restriction has been pulled back. And so you're seeing more utilization of home health, in more, if you will, at-home services, until issues like visitation and other steps are taken to move forward.
You comfortable with that, Donna? Great. We've taken care of our first media question of the day. Kevin?
Yes, I'm sorry. Yes, thank you for the input on that. I was just thinking, what families might be doing, and when there's an opportunity to send somebody to a long-term care facility, but the circumstances just simply don't present it. And sometimes in-home care just doesn't meet the bill. You've got to have more care. But thank you for the input and the time, Wayne.
You're welcome, Donna. And Kevin, thank you so much. You're welcome to stay with us. We're going to have some very interesting reports from some of our community partners here in just a second. We'll start off with Betty Rousseau from the Office of Governor Greg Abbott. Good morning, Betty.
Good morning, everyone. Thank you, Kevin, for that report. That was very helpful. Thanks. Just a couple things. I just saw an article I thought was interesting. Best and worst states to survive the pandemic. Texas is number 3 behind Ohio, and I forget what was number 2, but New Mexico was in the top 5 as well. But New York was number 50, and Alaska was in the bottom 5 too, which I thought was kind of interesting. But anyway, to go forward, Governor Abbott, Lieutenant Governor, and the House Speaker and some of the legislators announced that the state of Texas will allocate $200 million in coronavirus aid, relief, and economic security act funding to the Texas Education Agency for the purchase of e-learning devices and home internet solutions to enable remote learning during the COVID-19 pandemic for Texas students that lack connectivity. With this funding, the TEA will purchase and distribute devices, hotspots, routers, and more based on specific needs identified by local education agencies. Just wanted to let y'all know about that announcement. And then I'm going to hear a few funding resources I've just found out about. There's Business and Industry CARES Act program. The USDA is making available up to $1 billion in loan guarantees to help rural businesses meet their working capital needs during the coronavirus pandemic. Additionally, agricultural producers that are not eligible for USDA Farm Service Agency loans may receive funding under this. There's also the FCC High-Speed Broadband / Rural Opportunity Fund. The FCC designed this fund to bring high-speed fixed broadband service to rural homes and small businesses that lack access. And I guess that's about it. These others I don't think are as beneficial right now. They may be interesting, but I don't think quite as beneficial right now. But that's it for me. If you have any questions, just let me know.
Betty, thank you. And that's welcome news about the funding of for the TEA and the local school districts. In the last few days, the Chamber's received a couple of messages about concern with, especially in the area of rural internet capability. So that's wonderful news. And I'm sure the school systems and educators are going to be pleased to hear that. So any other questions for Betty? If not, I don't know if he's on the line. Senator Robert Nichols, are you with us, sir? I know Representative Clardy is with us. Good morning, sir.
Good morning. Great to be here again. Kevin, thanks for being there. I saw your message. If you need to jump off, you have to listen to me talk enough. You don't have to stick around for this if you need to go. But I think the topic I would like to cover with you is the information we just received from our comptroller and legislative budget board concerning the effect of COVID and other things on our economy, notably the kind of downturn in the energy sector. And long story short, we knew the bad news was coming, but now we actually have some numbers. According to the comptroller, as he testified to the legislative budget board, we have for the remainder of this biennium, they're projecting a $4.58 billion shortfall from the reduction in sales tax, severance tax, hotel tax, all these other sources of revenue. Taking into that certain assumptions. The basic assumption is that we will still be continuing with COVID throughout, but also contemplates the fundamental assumptions that the economy will continue to recover as we've all seen it happen. It also, but it's a fairly, I won't say it's not a rosy projection, but it's assuming good, reasonable growth and return of the economy, and with that assumption, we're for the remainder of the biennium we'll have this is called $4.6 billion shortfall. That's a lot of money, but put that in the context of a $250 billion biennial budget. So and the other good news is our rainy day fund, the emergency stabilization fund, still has a positive balance of around $10 billion. So we can manage the shortfall for this part of time. We have, in Texas, we're a pay-as-you-go state government. We don't have the ability, nor do we need the ability or want the ability to create money and turn on the printing presses. So we can cover our bills, do things for that period of time. The more troubling number to me is the projecting into the next biennium. So when we go back into session in January of 21 and build a budget for 21-22, the 2-year budget, those projections carry forward. leave us with somewhere in the magnitude of an $11 billion shortfall. So my expectation is that we can cover the shortfall for the remainder of this biennium with cash on hand, but that will leave us with fewer options and fewer resources to carry into the challenge of the next budget. So all agencies, state agencies, have been instructed to find 5% cuts throughout their respective budgets, including places like Stephen F. Austin State University. We are looking for places we can tighten our belt, but it's hard to, as the expression goes, cut your way to prosperity. And so we are looking at ways that we can grow grow the economy in a productive way, generate new revenue. That way, nobody is talking raising taxes or doing anything of that nature. But still, at some point, you have to meet the essential needs of the state of Texas. You do that prudently. You cut where you can, and so there will be many things on the table to discuss how we make that budget work next session. But 11 billion, again, that's I think a good number to work from. But also remember that does not contemplate other things that may not go well. So we're I'm an optimist by nature. I expect the economy to grow. I expect things to happen. But I think the last 6 months have taught us anything that sometimes the road can get bumpy when you least expect it. And so we are all concerned as we go back to next session and work on the budget. But again, a lot of the numbers are very positive. So we have seen that growth in the economy. So, but it's going to take a lot of work by everybody to get this back on track. Just briefly on the COVID numbers, I saw Lisa King put some in the chat room. I've talked with our CEOs. I talked with Jeff Patterson at the Medical Center. We have seen a bit of a bubble increase in our local hospitalizations, and particularly some of the high acuity cases. We do continue to have some capacity with both ICUs and with ventilators and other hospital beds, etc. But when we're not seeing the numbers at a crisis level that we are seeing in Houston, particularly, and in the Rio Grande Valley, Dallas is the big metropolitan areas more greatly affected. Heretofore, we have been, our peak came in April, and we're not back to those peak numbers here in Nacogdoches, but the trend is, we're all watching this very closely. And kind of to Kevin's point with long-term care, this puts an incredible amount of stress on our emergency rooms, on our physicians, on our nursing staff, on our aid staff that work in the hospitals, because again, this isn't something that goes away in a month or two. We have to be constantly vigilant. But I think we are getting better with our treatment regimens. As I've talked to some of our healthcare professionals, we understand the disease process better. I think I spoke at Rotary the other day. Everybody now knows somebody on a very personal level who's had the COVID-19 virus, or has had it, or has recovered from it, or is in the hospital. Whereas a month or 6 weeks ago, that was relatively rare. So it's becoming part of our normal life, and I think we knew this was coming. And sometimes, getting rid of the fear of the unknown makes it easier to deal with the problem. So familiarity, it maybe doesn't breed contempt, but at least it breeds some level of comfort and understanding. And I think we're moving into that stage, because we will be living with this for quite a while longer. So with that, I'll pause, but I think the big news, I'll amplify this Friday as I look at the comptroller's report talking about the budget. I'll have more of those numbers and figures. We'll talk about that on my 3 o'clock Facebook program. And we'll invite you all to join. We go Facebook Live. And so with that, Wayne, I'll turn it back over to you and be happy to answer any questions.
Thank you, Representative Clardy. Any questions for Representative Clardy? Well, thank you very much for that information, Travis. Appreciate it very much. I know that Les Linebarger from the NASD is on a tight time frame, so I'm going to pop you in, Les, right here. Good morning. Our communications director from the NASD.
Good morning, Wayne. Thanks for working me in like that. I sure appreciate it. I just wanted to let you all know right now we're exploring what Commissioner Mike Morath with Texas Education Agency said to us last week regarding a phased-in start to the year that might last up to 4 weeks' time. And during this same time frame, we've also heard the concerns of our teachers and staff, as well as some parents, about the restart of school and holding in-person classes. So in the coming days, we will be publishing information regarding the start of school. For the most part, what this will look like is there's going to be the online or remote facet of instruction, but we will still be required to provide in-person instruction to any students whose parents request it. So there's a lot of hoops to jump through there, and we're grateful for the direction from TEA over the past several weeks, but it's time for us to make some decisions so we can go ahead and begin moving forward. And we want to once again stress that we've heard those concerns from teachers and staff and parents about the safety issues regarding starting school under COVID-19 pandemic right now. Additionally, and this is somewhat related with all of this, the start of school and all, and having remote learning programs, we're preparing a plan to partner with businesses and organizations around Nacogdoches to provide some assistance with internet connectivity in something we're calling our Dragon Connected program. NISD would promote these partners as places students without reliable internet at home could bring their device to make contact with a Wi-Fi network where completed school lessons could be uploaded and new lessons could be downloaded. The way we envision this working, and North Street Church of Christ has already agreed to participate, so I'll use them as an example, is the parent and student brings the device to town and visits the church campus, and it would be in the parking lot, or in the case of a fast food site, perhaps the drive-through, while maybe the parents are making a purchase. And it would allow that student to make connection for a short amount of time. And the software that would be installed on these devices ahead of time would be able to upload that lesson in a rapid amount of time, and then it would also download any updates for new lessons the student might need to complete. Obviously, this is another tool that we're trying to use to combat the fact of something we've all talked about on here from one time or the other, that there's some accessibility issues at play, especially in rural counties like Nacogdoches, to get reliable high-speed internet. We will, as a part of this, we would be promoting our campuses along with these other partners as Dragon connected sites in just a way that we could get students, at least for a short amount of time, a connection to a reliable internet source. If any of y'all are interested or want to pass along this to others, please contact me or Aaron Wyndham in our communications office at NAC ISD. I'm going to post our contact info in the chat if you want to reach out to us by email or by phone. And once again, Wayne, thanks for the opportunity to participate in this meeting. Thank you very much.
You're welcome, Leston. I do want to let you know the Chamber does have a guest internet accessibility, and count us in on this. I'm confident that many others on this phone call would be willing to join, but you can certainly put us on your resource list for that as well. And prior to you jumping on this call, Betty Rousseau had indicated that the governor's office is going to make a special appropriation through TEA to assist schools, and that hopefully will be part of the factor in as a part of those resources. But we're rooting for you. There's nothing more important to economic development than education, and we're partners with you folks. So there you go.
Thank you, Wayne, and I'm glad you mentioned the plan that TEA is working on right now. We completed a survey last week, provide them with the information they would need for us to participate in that program.
Fantastic.
Thank you, Wayne.
Thank you, Les. And speaking of economic development, we're pleased to have the president and CEO of NEDCO, the Nacogdoches Economic Development Corporation, on the line. Good morning, Larissa.
Good morning, Wayne. Thank you guys for having me on. I'm going to run through a few data points just to let everybody know where we're standing. Unemployment numbers are trending downward, which is good, but they are not, it's not a real rapid decrease, which is kind of leading everybody to believe that these represent more permanent layoffs, not necessarily businesses that were closed temporarily, but businesses that maybe have closed permanently. So that's kind of a downer there, but just keep shopping locally. Like I've said over and over and over again, I was so excited to see our sales tax numbers were positive for last month. So if we keep shopping locally, maybe some of these businesses can come back and reopen. We at NEDCO did share a survey to small businesses to kind of see what their post-COVID, can't really say post-COVID, but what their plans are in the pandemic and what their needs are. The Daily Sentinel has been nice enough to work with us to send that out. Hopefully they'll be sending that out soon. So if you've seen that survey, please complete it so that we can have good data to work with. Sorry, I missed something on unemployment, just for an idea of what our unemployment losses are in Nacogdoches County. We've got some in poultry processing, so that's obviously Pilgrim's Pride, and our restaurants. Those are our two major categories as far as what the layoffs have been. And just to give you an idea, the new claims that are coming in each week are only about half of what they were when they were at their peak on April 4th. Next, on the unemployment thing, you may have seen that there is an additional $600 a week of a federal unemployment benefit, and that will be ending on July 25th. Congress has a couple of weeks to reach a new federal deal. Who knows if they're going to be able to do that or not, but we most likely will have a couple of weeks there at least, or maybe permanently, where that $600 a week additional benefit will go away. Now there's a couple of schools of thought there that may decrease unemployment, that may force people back to work who maybe right now were comfortable with their unemployment benefit. It may be some sort of another economic cliff though. So we may have some families who have been able to go out and spend money and pay their bills that wouldn't without that additional benefit. So just keep that in mind, that that's coming on. That last payment would be July 25th. Just a reminder to fill out your census forms. If you haven't done that yet, we're still sitting pretty low, and lots of people ask what in the world do they use that census for? To identify where medical resources are needed, and to identify, for example, a lot of the COVID funding that's come from the federal government to the state was distributed to the cities based on population. So if we get a bad census number in the next couple of months, the next time they do a funding based on population, we will miss out on money that truly is due here. Let's see what else. I think that is it. Oh, one last note on face masks. You may have seen that SFA is requiring face masks on campus, and they're reminding all of their students to maybe try to have 3 or 4 face masks that they bring with them. Just a quick little idea. If you want to produce some face masks and brand them with your company and provide them free of charge, guarantee you there's going to be some students that show up here without enough face masks to get them through the week each week. So maybe that's something that your business can do to welcome lumberjacks back here and also provide a little bit of branding for your company. That is all I have, Wayne. Thank you so much.
Thank you, Larissa. Thanks for all NEDCO is doing for this community. We really appreciate it. I don't think she's on the line, but Amy Mahaffey, are you on? Well, then we'll move on. Gary Lee Ashcroft. Gary Lee, are you still on?
Yeah, I am. If I can ever find, I'm using a new device and I couldn't find the mute button. Anyway, I just have a few things. Good morning, everyone. I have a few things to talk about. One, we are moving forward virtually and with enthusiasm and optimism, and that's the way it is. I'll talk about that more in a second. We're in the allocation process right now. It's pretty robust. It's all virtual, of course, and we are will at our 27th board meeting approve allocations for, I believe, 16 organizations that really are working hard and really do look forward to what we can do in 21, and we think we'll be okay. We base our allocations not on a solid number. We base our allocations on the campaign, and if we have a good campaign, it goes really well, then the percentages is what we base them on. For each organization, they get a little more. If the campaign, if I'm wrong and there really is some COVID anxiety in terms of giving, then the percentages will reflect that as well, and you get a little bit less if you're an agency. As we reported last session, this session, we were able to allocate $28,000 from our COVID fund, which was responded to very well. So I don't think there's a COVID fatigue in terms of donations to any of our organizations. I think if we express and communicate the importance of our purpose, the donation will come in. I think people are looking to donate. I think they'll donate to those organizations that they feel like are doing something towards helping those that need us most, helping folks that are affected by COVID. That's pretty much how we're going to allocate, is to those kinds of organizations. And we have a very good group of about 20 of our board members and people from the community that are evaluating this. It's always our Christmas time when we give away money. That's what we exist for, is to raise money and to support those who need us most. And then, of course, other programs like Day of Caring, where we mobilize volunteers and get them out doing things for people and agencies that need to be done. The campaign, I actually had an intentional prayer for this, and apparently Rex Perry heard that prayer via God. We do have a brand new Hyundai coming to us for our campaign, so that creates some excitement, and somebody ends up with a brand new car. Some of the people on this line may have won that car. We will have our kickoff in some form August the 18th at the Rex Perry dealership. It'll be a breakfast kickoff, not a cocktail hour. I didn't want that around in the COVID season, so it'll be a breakfast kickoff and have really good food. However, not that many people will get to eat that good food, because we're pretty much going to live stream the campaign kickoff into all of our donor companies and what have you. Hi, Bonnie. Then I want to talk about something very exciting, and Dr. Emerenti Oliphant at SFASU School of Social Work has been working on this, about the launch. We will, and for those of you who have organizations you may be interested in participating, we will have a formal, sponsored by the Nacogdoches Area United Way, volunteer training program. And we will bring volunteers to our training program virtually or however, and train you as to how to be focused and really good volunteers. That should be pretty easy, because we got just so many for the chamber, for CVB, for all of our organizations. Got great leadership, great volunteers, but there's a lot of people out there who have the ability and want to be volunteer leaders, and that's what the purpose of this is to train those folks. That's about all I got, unless somebody has some incredible question of me.
Any questions of Gary Lee?
Wayne, this is Larissa. I don't have a question of Gary Lee. Hi, Gary Lee. But Amy did give me her report, and she asked that I provide it.
Go right ahead, Larissa.
Okay, thank you. We do have a pretty high number of new positive cases in town today. You'll see that number today is 57 new positive cases. We Did want to clarify that those are largely related to a long-term care facility. And as we talked about, our speaker today did cover that those numbers can get out of hand very quickly at a long-term care facility, and we've seen it before. So please know that that's the situation there. Our positivity rate as far as testing goes, if you've heard Chief Kiplinger talk about that, that's an important number that we look at to kind of show the spread. And last week it was about 12%. This week, the numbers are about 15% of people that are tested are showing positive, so there's a slight increase there. There is about a 10-day wait for non-rapid tests. That's just something to keep in mind. Amy is at home sick, and thankfully she was COVID negative, but she wanted me to remind folks that it's important to be diligent about speaking with your physician. If you are homesick waiting a test, she ended up being negative, and this whole time she could have been seeking treatment for something that wasn't COVID. So just keep that in mind, be diligent about speaking to your physician, and don't just wait for that test result. Keep wearing your masks, keep washing your hands, stay home if you can. Thank you.
Thank you very much, Larissa, and thank Amy for that report. We appreciate it. We hope she gets well soon. I was aware that she wasn't feeling well last week. I'm sorry that she's still out. Last but certainly not least, from the hospitality industry, Sherry Cheney Morgan. Good morning, Sherry.
Hello. I wasn't on the agenda, but here we are. Hi.
It's a learning experience.
It is. I'm going to pivot. It's the word for 2020 is to pivot. We did receive our Smith Travel report giving us the numbers for hotel occupancy for the month of June, and they remained about the same, slightly lower than we were for May. We're looking at a minimum 2-year recovery time for travel and tourism statewide. A minimum business travel will be among the first things to recover, the first arm of tourism, and drive markets. Airline travel isn't forecasted to recover until 2023 fully. So fortunately for us, we are a drive market. We continue to see numbers of people coming in for day trips through our visitor center doors. And as such, we are always looking for volunteers to help us extend a warm welcome. If you're looking for action items, things you can do, keep Nacogdoches kind and keep Nacogdoches safe. Wear your masks, practice best practices in safety and sanitation, and be nice and courteous when you see people in. People, you know, there used to be on flights, the flight attendants would say, "We know you have a choice in travel, and we thank you for choosing Southwest." And that is very much the case these days. People do have a choice in destination, and we're always so honored that people do choose Nacogdoches. And we just happen to organically have a culture of kindness and Southern charm and hospitality here that keeps people wanting to come back. So that is it for hospitality.
Sherry, thank you. And, we appreciate all you're doing for the hospitality industry. Look, if no one else has anything additional, I want to take time, first of all, and thank Lisa King for posting those numbers for us to kind of give us a sense of what's happening in terms of the census at the hospital. I do want to remind you, reinforce the importance of filling out the other census report. That's critically important. I want to thank all of you that take the time to dial in, and certainly friend Kevin Warren, who joined us today from the Texas Healthcare Association. Please stay healthy, everybody, and we'll look forward to talking with you all next week. Thank you very much. This concludes our call.